Good afternoon. My name is John Kelly. I'm the publisher of the Orlando Medical News. We are blessed today to visit with Dr. Elisa Maria Bianchi, MD. She is a colorectal surgeon practicing medicine in Orlando, Florida at the Digestive and Liver Center of Florida. She is a board-certified general surgeon who completed colorectal surgery fellowship at the Zucker School of Medicine at Hofstra Northwell Health in New York. Her specialty training encompassed a variety of small bowel, colon, rectal, and pathologies, which included malignant, benign, and inflammatory diseases, such as Crohn's and colitis. Dr. Bianchi completed her general surgery at Loma Linda University Health with an emphasis on robotic techniques. Dr. Bianchi completed her medical training at the University of Illinois at Chicago. Her resume is very extensive, but what is really important is that Dr. Bianchi prides herself on developing a close rapport with her patients and making sure all medical options, not only surgery, are exploited to optimally treat the disease. Wow, Dr. Bianchi, what a resume. And I cut off 2 or 3 paragraphs. Welcome.
Hi, good afternoon. Thank you for having me.
What is your specialty?
I'm a colorectal surgeon.
Can you share with our audience exactly what a colorectal surgeon is and what they do?
Sure. So as you already mentioned a little bit ago, colorectal surgery is a specialized field within general surgery that focuses on the surgical management of benign and malignant diseases of the small bowel, the colon, the rectum, and the anus. Some of the benign diseases that we deal with are things like diverticulitis, hemorrhoids, and then some of the malignant ones that people commonly know are things like colorectal cancer.
So what exactly is a hemorrhoid?
So a hemorrhoid it's actually a vascular cushion that is composed of arteries, veins, and muscle fibers that are part of the normal anal canal.
And how does a hemorrhoid differ from an anal fissure?
So an anal fissure, it's a tear in the anal canal. The most common symptoms of an anal fissure, it's pain after a bowel movement. You can sometimes see also anal blood or anal bleeding, I should say. Compared to a hemorrhoid, well, like I said, hemorrhoids are vascular cushions that are present in everyone, but as we age, the older we get, then the higher the risk for us to have symptomatic hemorrhoids. One of the more common symptoms of patients that have symptomatic hemorrhoids is painless bleeding.
Okay. Are there any other symptoms that would present themselves specific to hemorrhoids?
Absolutely. So like I mentioned, the most common is painless bleeding. Other symptoms include, you can also get pain if you have a thrombosed hemorrhoid, and you can get itching.
Are there non-surgical treatments available for hemorrhoidal diseases?
Oh, absolutely. So most of the time, whenever we see someone with symptomatic hemorrhoids, we treat them non-surgically first. There are very specific situations in which surgical treatment is offered for hemorrhoids. But the most common ones we see, it's medical management, which includes doing behavioral changes such as increasing your fiber intake, increasing water. So normally I will recommend that they take a daily fiber supplement with their diet and to increase their water intake to about 6 to 8 glasses of water a day. They can also do warm water sitting baths for 20 minutes, 3 times a day. And I encourage behavioral changes such as avoiding straining when having a bowel movement and to limit their time on the toilet. In addition to this, most of us prescribe a steroid cream or a suppository that we recommend patients to use twice a day for about 2 weeks.
When would surgery be indicated for hemorrhoidal diseases?
When you have symptomatic hemorrhoids, they can either be internal hemorrhoids, external, or a combination of both. So depending on the presentation, that's how we also direct the surgical treatment. There are a few options that we can do in the office, which include rubber band ligation and sclerotherapy that we can sometimes offer that doesn't need, actual surgery, but it's still a procedure. The only thing is that, for instance, rubber bands, we can only do for internal hemorrhoids. And we do this because they don't have the same type of pain sensation as external hemorrhoids do. Now, in terms of the actual surgical treatment, we normally recommend that for patients that don't respond to non-surgical treatment.
After a patient has surgery for either a hemorrhoid or even an anal fissure, does the problem repeat itself? Does it reappear and come back, or would the patient pretty much be set for the rest of their life?
No, so I would say you can definitely have a risk of coming back. It also depends on the type of treatment that you initially had to deal with the problem. And one important thing that I want to reiterate is that we have to treat the underlying cause, whether it's because of constipation or other issues, and to make sure that when the patient makes the changes, they kind of learn that it has to be part of their life. So they have to continue to make their dietary changes and the behavioral changes. The fact that we actually do surgery doesn't mean that you're not going to have the problem again.
So the biggest challenge really is behavioral modification by the patient.
Correct.
Well, this has been very informative. If our audience would like to reach out and visit with you, how can they get in touch with you?
Yeah, so they can actually call our office, and the phone number is 407-384-7388, and the extension is 5. And they'll talk to one of our MAs, and we'll schedule an appointment for them. We're pretty flexible.
Well, thank you, Dr. Bianchi. This has been really informative, and I hope in the future we can get you to come back and visit with us again. I know that our audience would value it. Thank you very much, and have a great day.
You too. Thank you.